All right, guys, I'm going to start kind of giving some background and handle some housekeeping stuff. If you can see me, I am waving arms that disappear, and look, my whole self disappears when I do it. But I'm one of two people who have the ALS TDI virtual background, thus my disappearance. The other is John, whose arms seem to work okay with his background. Some of you I know, some of you I don't. I'm excited for those that I don't to get to know you and to hear your feedback on what I think is going to be a really, really cool conversation. You know, we have been aware of plenty of people using cannabis to alleviate symptoms throughout the course of their disease. And we constantly get questions from new people in the community on how to use it. And we do not feel like we always have all of the information to advise on that. And certainly it is not our place at ALS TDI. That is for conversations with your doctors. But we have some great guests here who know a heck of a lot more about this than we do. You are going to be hearing from them shortly. First, I'd like to thank you all for being here. And I would like to thank Apellis Pharmaceuticals for sponsoring all of our ALS Town Hall programs. Okay, so Zoom stuff. You are going to be muted during the presentation. We will be taking the majority of questions at the end. So at that point, you will be able to unmute yourself to answer the question, to ask a question if you have one. If you are unable to use your voice or are afraid that you will forget your question at the end, go ahead and use the chat. We have people monitoring that, so we will get your question. If we are unable to answer your question today, we will get back to you. If for some reason you don't hear from us in the next few days with an answer to your question, ping us. And the people that you will ping, I'm going to introduce right now. Along the way, you will hear from the development team at ALS TDI, who are kind of our community liaisons. I am one of them. And the rest of my team, could you please wave your arms? We have Claire Reach and Erin Stevens and Terry Handler. You will most likely, if you don't know any of these women, you will most likely hear from them in the next few days. You will also be receiving a survey to give us feedback on this presentation, this town hall. Give us ideas for things you'd like to have conversations about going forward. This is your forum. We developed this so that, especially during the pandemic, everybody would have an opportunity to gather and talk about things that matter to them regarding ALS. Now, also, you see your name. Mine says Carol Hamilton ALS TDI on it. If you would like to remain anonymous, you can take your name down or call yourself something silly, whatever you like, but we will be recording and archiving this video. If you prefer to turn your video off, that's fine. You can use the chat, you can still use your voice, and we won't see you. So no big deal there. Let's see. I think that's it. Is everybody feeling if you are not comfortable with how you are set up for this Zoom, please unmute yourself and let us know. You guys are good. Okay. From here, I would like to introduce John Gang, whose arms you just saw flail a few minutes ago. And John will be our host. I will be here throughout, helping to facilitate questions along with that team, some of whom you already met. So, John.
Thank you, Carol. I'm just going to share my screen here. Can everybody see that? Great. So welcome to today's ALS Town Hall conversation about cannabis in ALS, sponsored by Apellis Pharmaceuticals. So I'm just going to start. My name is John Gang, that you just heard from Carol Hamilton. Just going to start with a quick introduction to the ALS Therapy Development Institute for those of you who are not familiar with us. And then we are going to be joined by Dr. Juclay Charles, who is a pharmacist at Curaleaf, a national medical cannabis company, to give a brief overview of the medical cannabis landscape and some of the available products and some of the things people use them for. We'll also hear from Kate Neese and Angelina Fanous, who are two people living with ALS who have very generously offered to share their experiences with cannabis with us today. And then we will have an open town hall discussion where you can ask questions to any of the presenters and also share any experiences of your own with using cannabis to treat ALS symptoms. So just an introduction to ALS TDI. We are the world's most comprehensive drug discovery lab focused solely on ALS. We are one of the world's only nonprofit biotech companies, and we were founded in 1999 by the Haywood family. You can see them there down in the picture on the bottom left of this slide in the orange shirt in the back. That is Stephen Haywood, who was diagnosed with ALS at the age of 29. And the rest of his family, they were all MIT trained engineers. And when they found out there were no cures or treatments for his brother's condition, they decided to do something about that. And where you see them in that picture is the basement of their house in Newton, Massachusetts, which was also our first office. And today, a little more than 20 years later, we have over 30 research scientists in our lab, which just moved to Watertown, Massachusetts. And we put 87 cents of every dollar that we raise into finding effective treatments and cures for ALS. And if you look at the picture on the bottom right of this page, that's from our old lab in Cambridge, Massachusetts that we just moved out of, but that was just a couple of years ago. And Stephen Haywood unfortunately passed away in 2006, but in this picture you can see in the blue shirt in the middle his son. And so this is a family affair, and we're still working 20 years later in his memory to find treatments for this disease. Our impact on ALS, we perform rigorous research required to discover and invent potential treatments for ALS. We operate the world's first ALS precision medicine program, which is a partnership with people living with ALS all over the world to share data about their disease progression, their medical history, as well as biological samples and other information that is designed to speed up drug discovery and drug trials for ALS. And anyone in the world, as I said, can participate in it. And if that is something that you are interested in, we really encourage you to find out more about it. And you can talk to any of the development directors that Carol introduced earlier, and they can tell you more about it. We've also rigorously tested over 400 drugs in animal models of ALS, which is more than any other ALS research lab in the world. And we are the first nonprofit biotech company to invent a potential ALS treatment, AT-1501, bring it from our lab through FDA review and into clinical trials, and is currently in a phase 2 clinical trial. Then just quickly before we started, I wanted to talk a little bit about why we chose this topic, and Carol addressed it earlier, but it's important to say again that there is no conclusive evidence that cannabis has any specific benefits for ALS, and more research is needed to answer this question. But we do get a lot of questions about it, and strictly anecdotally, there are many people in this community that say that it helps them, so we wanted to provide this as a forum for people to discuss it and learn more about it. And we will have a staff pharmacist from Curaleaf, as I mentioned, on the call to present an overview of the cannabis landscape and discuss available products. As a disclaimer, due to cannabis regulations, Curaleaf can't provide any medical advice on a public platform, so they will be a little limited in what kinds of questions they can answer. And the staff at ALS TDI are never in a position to provide individuals with specific medical advice, and you should always consult your medical provider before making any changes to your medical profile. That said, we acknowledge there are a lot of people here on this call even who have used cannabis and believe it helped them, and especially our two speakers who are going to share their stories with us. And while we can't provide any personalized recommendations, we hope that in the discussion and Q&A portion of this event, you can learn from their experiences and even share your own. And with that, I would like to introduce Dr. Charles, the pharmacist from Curaleaf in New York City. And you can take that away, Dr. Charles.
All right, hello everybody. It's great to see everyone. Thank you for coming. Let me get my presentation pulled up for you all really quickly. All right, so good afternoon, everyone, or good morning, or wherever you are in the country. Hello, how's everybody doing today? My name is Dr. Jukla Shao. I'm a pharmacist at Curaleaf, specifically in the New York City dispensary, medicinal cannabis dispensary. A few disclaimers before I start this presentation. As stated, this presentation is purely for educational purposes. Unfortunately, I will not be able to provide any medical advice to anyone today, but just wanted to give a brief overview on medical cannabis and the landscape and the different options that you have as a potential medical cannabis patient in your state if it's available to you. So a little bit about myself. I'm a doctor of pharmacy. I've been practicing pharmacy for a bit over 6 years now, and I've been in the medical cannabis space for about 2 years. I'm really enjoying it, and I love to educate and teach patients about how to use cannabis effectively, and hopefully find some type of relief when using these medications. A bit about Curaleaf. So Curaleaf, we are the largest cannabis organization in the country with a mission to improve lives by providing clarity around cannabis and confidence around consumption. We are located in 23 of states across the country with 100 dispensaries throughout those 23 states. We grow or cultivate all of our own cannabis. And then we also handle the research and development of our products, the processing of our products, and then we run dispensaries all throughout the 23 states that we have licenses in. And we also love, again, we're big on creating confidence and clarity around cannabis. So events like these where we can provide education and outreach are also something that we love to do at our company. So this slide here just shows you the states that have some sort of legislation for cannabis use, whether it be medicinal or adult use. Something I always love to point out is even if you are in a state where it is more so adult use and not medicinal, you can, with assistance of the dispensary team and your physician, find products there that may be used to help with finding relief as well. All of the states, as you see in this map, all of the states that are in this pink are the states where you can find a Curaleaf dispensary. So we're known for our 3 brands, which are Select, Curaleaf, and Grassroots. Okay, so if you see any of the states here that you live in, you can probably come and find one of our dispensaries and get help from one of our staff members or pharmacists if there's a pharmacist available in your state. All right, so now we're going to get a bit of an overview on cannabis and its potential uses. So first question is, how does cannabis work, right? So cannabis works with something called the endocannabinoid system. All right. Your endocannabinoid system is a naturally occurring system within the body that helps you maintain balance, or what we like to call in healthcare, homeostasis. Your body's goal is to always be in homeostasis, or to be in this balanced state. And sometimes when we have conditions like ALS, it may throw off some of the processes that you have that then push you out of this balanced state. And the purpose of the endocannabinoid system is to manage your different systems and functions to help you maintain being in homeostasis or being in this balanced state. And the way that the endocannabinoid system works is that it's monitoring all of the systems and functions within your body. And when it notices that something isn't working effectively or working too much, it'll turn that process off, whether that be a pain signal or inflammation and things of that nature. So the endocannabinoid system works with chemicals that you produce on your own called cannabinoids. And those chemicals are the chemical signals that are received by cannabinoid receptors found all throughout your body. Now, because we have this system in place, we're able to interact with similar chemicals that are found in the cannabis plant. So the cannabis plant produces its own cannabinoids as well, and those cannabinoids are structurally similar to our body's cannabinoids, so they're able to work with the receptors that we already have in our endocannabinoid system. The two prominent cannabinoids found in the cannabis plant are THC and CBD. CBD can be found in hemp cannabis as well, but THC will only be found in medicinal cannabis or cannabis that you'll find at a dispensary. So CBD is known to be less psychoactive, where THC is known to have some of those psychoactive effects that are correlated with cannabis use. This right here is an example of how the different cannabinoids fit with our natural receptors within the body. So we have, again, THC and CBD, and they fit like a key in a lock with the receptors we have in our body. And when you activate those receptors, that's when you get the effects from the cannabis plant. When you're looking at the different types of medicinal cannabis products and cannabis products in general, you usually will see three main ratios. All right. So, and the three main ratios that you're going to see are going to be a high THC ratio in New York that may be called a 20-to-1. And in most places, they also have numbers correlated with the ratio. So your 20-to-1 product will be 20 parts THC to 1 part CBD, or a high THC medication. Those medications will also lean towards having more of the effects of THC or more of those psychoactive effects. Then you'll also find 1-to-1 products, or products that have an equal representation of THC to CBD, and they'll also have more of the balanced effects of the two cannabinoids. And then also you'll find 1-to-20 products, or high CBD products that will have more of the effects or qualities of CBD in terms of the effects that CBD can have on the body. One thing to point out here is that in certain states, the ratios may always be consistent, where it's 20-to-1, 1-to-1, and 1-to-20, where the first number always represents THC and the second number always represents CBD. But you may find in other states where the first number represents CBD and the second number represents THC. So you always want to ask the staff at that dispensary, the pharmacist or the patient care specialist, exactly what the ratio is, so you have a better understanding of which products you may be using. The other important aspect of knowing about your medicinal cannabis products are the different routes of administration. So the way that you consume cannabis affects how your body absorbs it, metabolizes it, and then affects the overall experience or relief that you get from the products. So the main 4 routes of administration will be inhalation, sublingual administration, products that you consume or swallow, or so the consumables, and then topical products that you may apply on your body. So inhalation, these products, you're breathing in the medication. They get that medication, those active ingredients or cannabinoids get carried with the oxygen in your lungs and go right to the bloodstream. So because of that, these medications have the fastest effect, all right? You'll start to feel something in the first 60 and 90 seconds, but you don't feel the full effect for about 15 minutes. So if you're ever to try one of these products, you always want to wait 15 minutes in between every dose, your first time trying it out, just to really gauge how that medication is going to affect you. All right. The reason why that's important is our golden rule with cannabis is to start low and go slow. So you always want to start with the lowest amount of medication that could potentially give you some type of effect or relief, and slowly work your way up so that you don't over medicate, and which will lead to you feeling the psychoactive effects of THC. So after that 15-minute onset period, this medication lasts within the body about 2 to 3 hours. So fast acting relief, but also a shorter duration of action, a shorter period where you're going to be feeling those effects. Then you'll move on to the sublingual products. So these are medications that will be absorbed under the tongue, and they can be tinctures, lozenges, or some orally disintegrating tablets. So when these are absorbed under the tongue, they take about 15 to 30 minutes before you feel the effects, but then they last much longer in the body, about 4 to 6 hours. So if you're looking for more long-term of an effect, you'll find that with these sublingual products. Then you have the consumables. So these are products that you would digest, right, or have to swallow. These would take about an hour to 2 hours before you feel the full effect. And then they would stay in your system, depending on the formulation and your metabolism, between 4 to 12 hours. So much longer duration of action. And then you have your topical products. So these products can be applied locally to specific areas where you were looking for relief, and they work more instantaneously and still have a more localized effect where you may not feel the effects all throughout your body. As you can see, there are multiple options and choices for you in terms of what types of products you can use, and depending on what is effective for you and also what you can do in regards to swallowing products or holding things under your tongue, you have options of what you can use in terms of ease of administration. THC to the CB1 receptor can help to reduce the excess glutamate that is produced by the nerve cells. And in a 2012 survey of 48 patients who used cannabis, they all stated they had some type of positive, or they found some type of positive benefits from their cannabis use. Patients stated they found improvement in appetite, sleep, the ability to swallow, mood, and even better speech. Typically, and as you can see on this chart on the right-hand side, typically these are a few of the symptoms that patients state that they're using their medicinal cannabis for. So whether it be pain, spasticity, that wasting syndrome, dyspnea, or the ability to swallow easily, the drooling that can occur, depression, and neural oxidation. All right? So these are the different ways that some patients state that they use their medicinal cannabis. This slide here is to show everybody the states where where ALS is a qualifying condition for cannabis. So all the states that are highlighted in pink is where, if you have ALS, it is a qualifying condition that when you speak to your physician, they will be able to approve you for a medicinal cannabis card. All right. I don't want this to discourage anyone, because in all of the states that you have medicinal cannabis, a lot of the symptoms of ALS are also qualifying conditions on their own for medicinal cannabis. So the best thing to do is, if you're interested in using cannabis or integrating cannabis into your ALS regimen and treatment, you will always want to speak to your physician, tell them that you're interested in using cannabis, and they'll go over the different symptoms that qualify you for the medicinal cannabis program in your state. Again, it's important to reach out to your physicians and advocate to use cannabis, because the more physicians are aware of this medicinal cannabis as a choice for their patients, the more they'll be able to educate themselves and also educate other patients like yourselves on the potential use for cannabis within ALS. Thank you for your time. That was just a brief overview of medical cannabis in the United States and with ALS. I hope you all learned something from this presentation, and thank you all for having me.
Oh, Dr. Charles, that's great. Thank you so much. I certainly learned something, and I think it's probably great for everybody on this call just to see those maps that you put up, because I know for us it gets confusing, and for the patient community, they get confused about how they can avail themselves of some of these products. So that is terrific. As I said, we're going to hold questions till the end. You are welcome to use the chat if you'd like. But in the meantime, I'd like to introduce you to Kate Neese and Angelina Fanous, who John mentioned before. I believe Kate is going to be up first. These are two young women living with ALS. I can't swear on here, but these guys are freaking superheroes. They mean an awful lot to this community and are going to share their experiences with medicinal cannabis with us. Thank you so much, Kate and Angelina. Kate, you're up.
I'll just jump in real quick. You might want to put your Zoom on speaker view to be better so you can see them big, since they won't have a presentation to share.
Do we want me big, John? Really?
We do.
Yeah, we do. You can even pin her. You could leave Kate there the whole time, the rest of the time, if you wanted. Just
Nah.
You look great, my friend. You look great.
Thank you. Good to see you, Chris.
Uh-oh, you muted yourself, Kate. A really lousy way to deliver a presentation. So yeah, there we go.
I mean, it would have been less stressful. So my name's Kate. I was diagnosed just about 3 years ago. My use of marijuana was initially for anxiety when I was first diagnosed and couldn't sleep. I was using just a rolled joint or a vape pen, and that would take effect pretty quickly so I could calm down, get to sleep, stay asleep. Then my neurologist yelled at me. Smoking with our lungs can be not a great fit, so she advised finding edibles. And I generally use these when I've had a long day. So I was at work today, 8 to 2:30, and presenting. I'll get spasms here in my tongue and neck. So I'll probably eat a gummy maybe in the next hour. And that allows enough time to kick in before the very painful spasms occur. If it's more localized, like a calf or a foot, I might use a CBD balm, and that can kind of kick in a little faster. So playing around a little bit for what you're treating, what actually works. Edibles can be kind of unpredictable. So depending on what I've eaten, might take more like 2 hours to kick in and help relax the muscles. So the tincture under the tongue can be better, or like I said, the topical balms. Those were the main things I think John asked me to talk about. Oh, the other one I find helpful, back when I was smoking, it was a lot faster, but the excessive saliva, when you were inhaling the THC, it would help dry that out pretty quickly. Downside, watch out for constipation. But that was also a symptom that responded very well. Angelina, do you want to jump in?
Go for it, Angelina.
Hi guys. I prepared a little speech because my voice is not the best. But hold on.
First, I'd like to thank ALS TDI for hosting this event and inviting me. I've been living with ALS for over 7 years, and cannabis has been such an important and integral part of treating my symptoms. During those 7 years, I've experimented with each cannabinol and devised a regimen based on how they affect me. My main conclusion was that THC has an inhibitory effect on the motor nerves. It's called getting stoned, right? Turning my body to stone isn't exactly ideal for someone who has trouble moving. But I knew that we could reverse the psychoactive effects of THC with CBD, so I figured it was possible to reverse the physical effects of THC. After a lot of trial and error, I found a combination that, I believe, has a stimulating effect on the motor nerves. After I ingest a combination of THCA, CBD, and THC in equal parts, I can move and speak with greater ease. The first time I ingested this combination, I felt like a marionette puppet and someone had finally pulled the strings. I ingest about 20 mgs of each THCA, CBD, and THC in a tincture throughout the day. For days when I'm more active, I adhere patches to my wrists that contain those cannabinols, and that gives me more of a boost. Smoking also amplifies the effects. Each delivery method, whether it's topical, ingestion, or inhalation, has its own effect, and combining delivery methods can increase the potency. I should be very clear that this has only worked for me. I shared my elixir with Audie Barkin, and he did not experience what I experienced. But I still stand by my hypothesis that THC can stimulate the motor nerves to aid with movement. And I've been using that hypothesis to guide me. When I try any new cannabinol, like CBG or CBN, I first assess how they each interact with THC. For example, CBN increases the psychoactive and physical effects of THC, so when I combine those two, the product is an incredibly potent muscle relaxer for a good night's rest. There are hundreds of cannabinols in cannabis, so needless to say, we need lots of research and focus on this amazing plant with huge untapped potential. Thank you again for including me in this important discussion.
Angelina, you know your stuff. Shocker.
A little. It's a little more in the weeds, I guess.
Is that a pun on words, by the way?
I mean,
that was really interesting and very cool. So I see some questions coming up through the chat. I'm going to start off, Erin, first with one that I know that we receive a lot. And Dr. Charles, I'm going to ask for your help with this one. So we have people from across the country who fall in those pink states, the blue ones, the gray ones, everything. If you live in what is the best way for people to access medicinal cannabis depending on the color of the state they're in?
Pardon me, Carol, could you repeat that one more time?
What is the best way for people of all of the different categories of states where there is adult use, medicinal use, and so on? What is the best way for them to access cannabis?
So the best way to access cannabis is going to be in line with the regulations that are in your state. So if you're in a medicinal state, it probably requires you to see your physician, and your physician is authorized to certify you or give a statement to the state that you have a condition that allows you or qualifies you to be a part of their medicinal cannabis program. If you're in an adult use state, then that's where you probably have the ability to just walk up into a dispensary and you're able to manage that process on your own. Some adult use states also have medicinal programs. So there is a benefit to following or going through this process with a medical or health professional. So I would still recommend that even if you're in an adult use state. And then if you're in a state, unfortunately, it does not have medical cannabis, a medical cannabis program, I wouldn't advise you to partake or try to attempt to start one on your own per se, right? So I would say whatever the regulations are in your state, I would follow that. And if you are in a state that is both medicinal or has adult use, I would still try and go through that adult use program because there is a lot of added benefit of having the assistance of a health professional.
And in the states where people can avail medicinal cannabis, will insurance cover it?
Great question. So cannabis is still unfortunately federally illegal, which means a lot of the normal processes and procedures like using insurance or using your credit card are things that you cannot do within the medicinal cannabis or in the cannabis realm, right? So we can't really do any bank transactions, and insurance companies are not reimbursing or paying for these products for patients at the moment.
Awesome. Thank you. Does everybody kind of get that? Cool. Erin, you want to hit us up with some questions? Got some from the chat? Erin, are you frozen? I think so. Okay, would anyone like to unmute themselves and ask a question? Then we'll get back to those that are in the chat. Is there anyone else too?
I wouldn't mind asking a question if that's okay.
That'd be great. Who's that?
It's Dave Rogers here up in snowy Toronto. Yes. I'm curious. I've been doing some reading on the neuroprotective attributes of cannabis, and I'm wondering, you know, if your guests have any experience with that, if they're finding that this is something that has merit.
Dr. Charles, you want to try that one? You want to hit that one first?
So I can't make any definite statements on that. Unfortunately, there aren't any FDA approved studies that show that with cannabis. There is a US patent though that does show and state that the cannabinoids do have antioxidant qualities. And some of those antioxidant qualities could potentially be applied to the to a neuroprotective quality that can occur with medicinal cannabis. But unfortunately, I wouldn't be able to give you a definite answer on that or be able to state that that is 100% true or a fact.
Got it. So if I may, just to follow up, sorry, I'm having trouble with my Zoom. Then, and I know you're not making a recommendation, so with all the appropriate provisos, do we have a sense for a range of dosage that which would go along with this patent that you're talking about?
Oh, so this is a question I could definitely answer. So cannabis is something that works synergistically with your body, right? So just like the two patients who told their stories, they have different methods and different types of products that they use. Everybody's dose, right, is going to be different. And it may be some trial and error before you find the effects that you're looking for in particular. You may have a higher tolerance, you may have a lower tolerance. So it's really dependent on the person, the dosage and the amount that you need, and the different cannabinoids and what ratio will work best for you.
That's really cool. Just like we heard from Angelina that when Adi tried, you know, a similar regimen, it was very different for him. So that's good.
Hi, I have a question. My name is Priscilla. I'm from Connecticut. I'm new to the ALS diagnosis. My question had to do with vesiculations and whether cannabis increases them or whether it would help reduce them.
Dr. Charles, do you have anybody that you've worked with that, you know, comes in for fasciculations? And then it sounded to me actually too that Kate has some experience with that. You want to, let's hit you.
I was going to offer, when I was first diagnosed, I just tried CBD gummies from the smoke shop. It sold vapes and all kinds of things, but no THC products. And that seemed to calm them down pretty well. So if it's not legal where you are, CBD may be accessible just at a generic gas station even.
Okay, thank you.
I have a question.
Oh, lots of questions. Awesome.
Diane, I think you got the first syllable out first before Dave. So Dave, you're next.
This is Diane Layden. I think you have a different Diana, but she can go.
No, that's who, yeah, I'm talking to you.
Oh,
yep.
Okay, because I saw a different last name. First, I'd like to say hi to Terry Handler, who I communicate with periodically. She's been very helpful.
Great.
And I told her that my husband has ALS, bulbar ALS, and he was having some issues with secretions. And we do have medical marijuana in the state of Pennsylvania, and he uses the tincture sublingual at night. He's used 5-to-1, meaning 5 THC and 1 CBD, or 8-to-1. And that has just taking 1 dropper full, which is 1 ml at night, has helped him tremendously. And he no longer has any excess secretions, even during the day. So I thought I'd pass that on.
And Diane, can I ask you about that then? How did you get to that dosage?
We just tried different one. He started off with a 5-to-1, and he didn't think it was helping at first. So he went to an 8-to-1 THC CBD. And then the pharmacy that we were going to, we had a hard time getting the 8-to-1. They never had it available anymore. So we went back to the 5-to-1, and that's been helping him. I think the secret was that using it every night, not just using it occasionally. He also takes Mucinex almost every day. Not quite. I generally have to remind him to take the Mucinex. But he doesn't have a lot of like mucus or anything, but it was just the extra saliva. I do have a question for Dr. Charles, is where it says that the gummies would be better taking at bedtime because it lasts longer. I guess we just found a Curaleaf that's only a couple miles from us, a dispensary that just opened up maybe 2 weeks ago. And before this, we had to drive about 12 miles to the pharmacy, like a cannabis pharmacy. So I think what our best option might be to meet with the pharmacist there and discuss with them about maybe trying a gummy at night or something you can chew. Maybe that would last longer than, and maybe even be more beneficial. He's starting to get like, I call them seizures of his leg. He gets this like sudden, rapid spasm of his leg that only lasts 1 or 2 seconds. It's not a cramp. It's just shakes like someone having a seizure, and then it goes away. And they generally only happen at night. Does Dr. Charles have any comments on that, the gummies versus the tincture?
So this is definitely going to be more of a patient preference. I think for me, yes, the gummies, because of the way that it is absorbed, right? You're chewing it, so some of it is going to get absorbed in the oral mucosa or in the mouth,
right?
And then the rest of it will get absorbed via your digestive system, right? So because it's being absorbed via your digestive system, it does take a little bit longer to work. So when you're talking about how long it takes to work, that might be a con instead of a pro. But then once it does kick in, it's going to last in the body much longer than a tincture does. The reason why I love the tinctures as a product is because it's in a liquid formulation. You have more control over the dosing, right? You can be exact to the milligram how much medication you want. Whereas with the gummies, those doses are pretty much set. So you may have to do a 5 milligram dose and then a 10 and then a 15. Whereas with the gummies, you can do 10 milligrams, 11, 12, 13. I mean, with the tincture, you can do 10 milligrams, 11, 12, 13, right?
Okay.
So you have more control with the tincture. Pardon me.
That's okay. I never saw a higher dose than an 8-to-1 tincture.
Right. So the 8-to-1 is the ratio, right? But the dropper full is where you get.
Oh, right, it's the milligrams, right?
Right. So
I think I remember seeing that on there now, and I'm aware with the tinctures, anything sublingual is absorbed into the bloodstream immediately.
Right.
I'm a retired hospice nurse, so I'm familiar with,
Right. So so it kicks in a bit faster. You're avoiding a bit of metabolization. So you get, it takes about 30 minutes to kick in, and then you get that 4 to 6 hours of duration or of effect. The beautiful thing about you being in Pennsylvania and the last young lady who spoke who's in Connecticut, you're both in medicinal states where pharmacists are involved in the cannabis program. So it's great because you can go into the dispensary and speak to the pharmacist directly, and they could really, give you that fine-tuned answer based on your symptoms and your experiences on how to use these medications.
Okay, well, thank you very much.
No problem.
Dr. Charles, I'm going to hit you with a follow-up on there before we go over to Dave. And there are two things that Diane had to say that I thought were interesting, and hopefully other people do too, because otherwise I'm just taking up Dave's time, and that's not very nice. But one is there a difference? Would there be a difference between a 5-to-1 tincture and a 5-to-1 gummy? Do people find that? Overall effect. And the other question from what Diane had to talk about was that it sounded like after repetitive nightly use, a lower dose of THC seemed to suffice for them. Is there any scientific evidence that supports that, repeated use has an effect on the effect of the drug on you?
All right, so I'll do my best to answer both of these questions. So
to
your first question, does a 5-to-1 tincture and a 5-to-1 gummy, will they work differently? There is a lot of potential for there to be a different type of effect, right? Because when you consume something, it's going through your entire process throughout your body, right? So it's getting absorbed in your digestive system, then it's getting metabolized by the liver and broken down. And when that metabolization occurs, it's going to change the structure of some of the chemicals that are in that original product. So because of that, that's why you experience it a bit longer when you're consuming it, but the effects may also feel, or the effects will also feel a bit different in comparison to when you used it under the tongue, in comparison to if you were to inhale that same ratio. So it's definitely something to keep in mind, that it's not going to be the exact same effects. Even if it may be the same exact dose and the same exact ratio, the effects may be a bit different because of the route of administration or the way that you consume the product. Now, to your second question, pardon me if I am blank. Could you repeat your second question?
Is there any data to support that continued use might affect your dosage?
There is no scientific data to my knowledge that continued use would affect your dosage. What I will say is, just like any other substance, your body may build up a tolerance to these medications. So that's where you may see an adjustment in the dosage that you need after a longer period of time. But something that I have heard from patients that come in when they speak to me is that they do notice a difference after using things consistently, right? So they may not feel like their medication is giving them the effect that they want the first night or the second night, but then after 3 days of use or 3 weeks of use or 2 weeks of use, and everybody's going to be different, that's when they say, oh, it's really working the way I expected it to, or I would have liked it to. So again, especially with cannabis, it's going to be some trial and error, right? But that's why it's beautiful that you're in control, right? You can increase the dose, you can decrease the dose, you can use it once a day, twice a day. You can really find out what works best for you. And through that trial and errors where you may find something that's effective for you.
That's
I have a question.
Hi, Cherry. I promised Dave that he was next, so I'm going to go there next. Sorry,
No
Cherry.
worries.
You're
No
up
worries.
next.
No worries.
Go ahead, Dave.
Okay, hey, thank you for taking my question. Am I coming through all right here, first of all?
Yep.
Okay, basically, before I ask my question, I just wanted to touch back on like any kind of salves and such like that. I have a friend of mine that makes a THC CBD mixture. It's awesome. Anybody who has muscle pain, anything like that, if you haven't tried it, try it. It's great, at least for me anyway. So I just want to touch on that. Now, my question being is, for something for relaxing before bedtime at night. It's like, I tried like an indica and it's like, it relaxes me, it helps my muscles. But then it's like, the paranoia that comes with pot, like when you're 25 years old and you think that every car behind you is a cop. It's like,
yes,
it's like I'll be laying down and all the things that ALS sucks about, it invades my brain and my brain won't shut up. And it's like, I like everything about it as far as relaxing, helping my muscles, helping everything. And then I'm at night, the lights are off, and then my brain won't shut up. That is what I have a question about. If there's anything, any suggestions, something about that, it's that one thing about the cannabis, no matter which way I do it, shut up, brain, I want to go to bed. So there we go.
All right, so I'm gonna try and answer this the best I can in this forum. So one thing I will say is that yes, with THC, we have an understanding that there may be some side effects with THC in certain amounts that cause anxiety in certain patients. And again, this is going to be different with every patient. But one thing that I have noticed is it's really in regards to the amount that you consume, right? So if you decrease your dosing, potentially, you may find that you have less of those effects in terms of the anxiety or the paranoia. And that's what comes with microdosing the medication. That's what comes with microdosing the medication. Also, what I have heard from a lot of patients is that some of the more balanced medications, like those 1-to-1 formulations with equal THC and CBD, may potentially avoid some of those side effects as well, because of how THC and CBD supplement each other within the body and help to control some of the effects or side effects.
Yeah, CB, I would like to add that CBD reverses the psychoactive effects of THC. So if you add a little bit of CBD, it'll actually relieve a lot of the anxiety.
Thank you.
Jerry.
Yeah, hi, a couple things. I do take a little THC every night. And for what with Dave, what he was talking about, I think maybe Dr. Charles was correct that it may be too much, Dave. You can take too much THC at night and then, you'll be high all night. So that's a little bit too much. But the other thing that I wanted to ask was, so I do take a bit of a THC gummy every night, and it really helps me sleep. And in fact, I have fasciculations, and those are the only symptoms I have are fasciculations in my arms, my hands are tremory, and my legs. I do take magnesium and potassium for the cramps. But one of the things I was wondering was with CBD, I have a friend who was creating CBD gummies, and he actually increased the milligrams to 70. So I tried the 70 milligrams of CBD, and it didn't really stop the fasciculations. I thought it was going to. I had read where some studies that had shown that CBD can stop fasciculations, but I didn't find it to be really effective. And so I stopped buying them. And I wonder if the tincture would be more effective, or, I did increase I know that the CBD 70 milligrams is high, but I also read a thing where with my weight, which is maybe 162, I need 100 milligrams of CBD. And I did try, 1.5 of these 70s, and I'm not sure that it really worked. So I'm curious about what Dr. Charles might say about CBD and fasciculations. I don't have anything other than fasciculations. I'm slow developing, as Dr. Walk tells me, and so just wondering if with fasciculations, is there a way to mitigate fasciculations?
So I do know that muscle spasms are or vesiculations are some of the symptoms that people do use their medicinal cannabis for. One thing I will speak to in regards to your question about CBD and the higher dosing of it, this is where the beauty of like medicinal cannabis or just cannabis in general comes in. So the cannabinoids are all meant to be consumed together. And there is some information out there. And again, I can't make any grand statements, right? But when they are consumed together, sometimes they work a bit better for every patient. So again, this may change. So sometimes that's why we have all of our products with ratios that still include a little bit of the other cannabinoid, right? So for every patient, it may be different, where CBD on its own works great for you and you get some effects, but sometimes you do need that little bit of THC to get the CBD going and vice versa.
I see. So maybe what I should do is and I'm guessing, Dr. Charles, that you feel like maybe 5 milligrams or 10 milligrams of CBD of THC versus CBD. Like, do you have a ratio? Do you think that would be more effective?
So yeah, unfortunately, I wouldn't be able to give you like an exact ratio that works for you. But it's really going to be trial and error. Like Angelina said when she was speaking, the different combinations are going to be different for every person. So it's just really about figuring out what works for you, what combinations work for you, and seeing what will be best or gives you the effect that you're looking for.
All right, I really appreciate that information, and I may try this again. I left the CBD tincture and gummies because it really wasn't stopping the fasciculations, but I may try it again with just a little bit of THC to catalyze the CBD.
Yeah, that was really interesting to me. I'm learning so much. Thank you so much. That's very cool. I wouldn't have known that either, Jerry. We're going to hit a chat question now so that we can, I think there are a few in there. Erin or Emily, you want to bring up the chat question?
So building off the kind of safety topic, we were asked, I know a lot of ALS patients are on antidepressants or anxiety medication. And are you able to share if people should still be going out and trying cannabis if they're already taking a prescription medicine like that?
So great question. This is why I always am an advocate for using medicinal cannabis with the assistance of a health professional in your state. So cannabis can potentially, there is potential to have drug interactions like with any other chemical, any other substance that you take, right? Like grapefruit juice can interact with some of your regular medications, for example, right? So you always want to work with your physician or work with the health professional at the dispensary that can really break down and look at all of the medications that you're taking and give you some feedback on how to avoid interactions if there's potential for them, or minimize those if you still want to move forward with cannabis use.
Thank you. Am I okay to ask another question from the chat?
Yeah, go for it.
We've gotten a couple questions about the purity of the cannabis, and excuse me for not necessarily knowing the right language, but I know that there's a lot of off-label drugs that are being used. For example, one of them that was referenced was Tudka that people will kind of get over the internet. I guess people are asking, what is the purity of cannabis, or how can you tell if it's pure?
This is a great question. So this is also why it's important to partake or participate in the medicinal cannabis program that is legislated in your state, right? Because most of the states, in order to be an official dispensary or a manufacturer or a producer of cannabis, you have to follow certain guidelines. And for example, in New York, all of the products that we produce here at Curaleaf are then tested by a state-run lab that will test for, bacteria or pesticides or chemicals that could be harmful. And that's how the patients know they're getting a product that is safe for them to use, because the products are regulated, right? So yes, even you may have access to cannabis in the legacy market in your state, right? But it's important to go through the regulated processes or dispensaries, because that's how you know your product is going to be safe.
Great advice. Great.
Another question we got was, how would you suggest somebody that has a PEG tube or a feeding tube take cannabis?
So I think if somebody has a feeding tube or a peg tube, just like most of you, nutrition may be liquid at that point. I think products like tinctures might be the best bet for you because it is a liquid, and then it could be mixed with anything that you're drinking or being put into that tube and being consumed in that matter. So even though it's a tincture that is normally absorbed under the tongue, right, and has that 30-minute onset period, it's probably gonna work more so like a consumable will, because it's still gonna have to get digested and then metabolized. So it'll take a little bit longer to kick in, but at least you can still use that formulation in that fashion with your peg tube.
That makes total sense.
And then, and I saw this in the chat, which is great. There are some dispensaries that also create products like suppositories that you can use if that's another route of administration that you want to take your medications.
I'd like to make a comment if I can. This is Jay from Florida. You know, I have a doctor in Florida who advises me as to what to take and how to take it. It'll be 3 years that I've had my diagnosis in May. And I've been using, you know, cannabis and marijuana even before I had ALS. But I find that with the doctor, he basically says it's a journey and you have to try different products in different amounts to find what's good for you. And, you know, it's very difficult with generalities on amounts and things of that nature to judge, you know, what you should be taking. But, you know, I've used the tincture. I use it in the morning, you know, to help me get my muscles moving in the morning. And it doesn't, you know, affect me psychologically or psychoanalytically. And then I try not to use too much during the day as I'm still working, and I don't want it to impact that. And then at about 5 o'clock, I will start microdosing, either through a vape or, you know, smoking through the evening to help. And it's very difficult to basically say a dose of, you know, of 5 milligrams is going to have an impact. It depends on how big you are and how much you've used. I do find that the more often you use, you build up a tolerance. And, you know, there are times that, you know, I feel very, very little about, you know, very little. And then I try to increase the dosage. But again, my point is that I find it extremely helpful with my muscles and my legs. The person mentioned before that she felt like it was a marionette. I'm able to move my legs and really get a lot more movement when I use it. But again, I would say 2 things. If you have an opportunity, speak to a doctor about it, you know, who gives you the license, a cannabis doctor. And it's your own journey. You have to see what works for you. That's the only comment that I have.
What was your tincture? What milligrams and what cannabinoids?
Did you get that, Jay?
Yeah, okay. What I basically did is I used the 8-to-1 in the morning. I had started with 4-to-1, didn't do anything, or 5-to-1. So I did 8-to-1 in the morning, and it helped, and I was able to function and move. And then when smoking, you know, at night, I either use a vape or I smoke. And the vape is supposed to be 5 milligrams each one. Sometimes I'll have to take 3 or 4, you know, to feel any relief. If I'm smoking, you know, I find that if I smoke a half of a joint or a little less than a half a joint, within 5 or 10 minutes, I'll feel relief. After a couple of hours, I feel I have to do it again, and I do it again, and it helps. By the time I go to sleep, I have no problem.
That's awesome.
A question that we got that I think a lot of people might find really interesting is it's very related to ALS treatments. So I'm not sure Dr. Charles would be able to answer it, but maybe people in the community would be able to speak up about it. What are some side effects of the use of cannabis in conjunction with riluzole or Radicava, the two approved treatments for ALS, or even if anybody's on the off-label or open-label extension of AMX0035? I think people are curious about if anybody has any anecdotal experience. I think what we've learned today is that it really is different for everyone, and everyone just has to figure out what is best for them. But if anybody wants to share, please feel free to unmute yourself if you're on Radicava or AMX0035 and haven't had it.
Aaron, I'm doing riluzole and inosine, and I find no conflict with CBD or THC with those two. So I'm not doing Radicava, but I am doing riluzole and inosine. So, and I find no conflict.
Thanks for sharing, Jerry. Appreciate it.
Yeah, of course.
You know, a similar question that I would have, and I imagine the answer is yes, but if someone is participating in an ALS clinical trial, can they participate if they are using medicinal cannabis, and do they need to declare it if they are allowed to participate while using it, generally? Has anyone used medicinal cannabis while in a clinical trial that wants to speak? And Dr. Charles, you may not be able to speak specifically to ALS in this case, but do you have any thoughts on medicinal cannabis and clinical trials in any disease indication or in general?
So I won't be able to speak directly to like ALS trials, but just from the education and understanding that I have of how trials are run and produced, I think anybody running the trial may ask what other substances you may be using, just to gauge other chemicals that you may be consuming that will have potential interactions with the medications that they're studying for. Whether that'll exclude you from the trial or not would probably be up to the people using the trial or conducting the trial. So I wouldn't be able to answer that with any certainty. But usually I know, like, when you go to your physician, they ask you, like, do you drink? Do you smoke, right? They ask you these questions because all of those social aspects can have an effect on your medications and your health, right? All of those lifestyle aspects can have effect on your medications and your health. So those may be questions that might be in your survey, but I can't speak to how that affects whether you'll be included in trials or not.
Great, thank you. Yeah, just something.
Carol,
yeah,
I can answer that. My husband is in a clinical trial, and he's on the tincture cannabis, and it did not exclude him from participating in the trial.
Right.
All right, and he also takes riluzole.
Yeah.
Yes, Carol, this is Gary Trout, can you hear me?
Hi, Gary. Yes, I can.
Okay, I'm in, the one gentleman was in snowy Toronto, and I'm 900 miles southwest of Toronto in the Ozarks of Arkansas. And it's 19 degrees and snowy here too. And I've just got started on an oral Adeveron trial. And I think I'm the first one in the world that got started on this 3A study. And I don't know all that much about CBD oil, but I did get a free bottle of it. And I've just been using about 8 drops in the morning and 8 drops in the evening, and no problems at all with it. And so I don't know if it's helping or not with the CBD oil, but so far my symptoms are just in the lower neurons, you know, my arms and a little twitching in the legs, nothing in the breathing or in the swallowing or tongue or anything. And so I don't know if that would help anybody out, but I'm just saying I'm in that study, and nothing was mentioned about not being able to use CBD oil being in that oral Adeveron trial.
Awesome. And thank you for participating in that trial. That is wonderful. I mean, it would really be life altering for a lot of people if Adeveron, which is Radicava, anybody who doesn't recognize the other name, could be delivered orally rather than through infusion, that would be awesome. And something you just said too, Gary, made me think. John, I'm going to ask you to pull up that slide. I'm going to do a little PMP plug here. You know, one of the things we talked about is how do you discern what it is that is having a potential effect on your course of disease, right? It's hard to isolate the variables. So those of you who are on here, and I see a couple of you who I know are already involved in the precision medicine program, but for those people who are living with ALS who are not, I would encourage you to participate. It is the longest running translational research program in ALS. And the coolest thing about this is you guys hold a lot of keys to eventually developing treatments for this disease. But you're going to get mad if we cut you open to find all of that information that you have. So we have found a harmless way to learn from you and partner with you as we eventually crowdsource to find treatments for ALS. In the meantime, through the precision medicine program, you will be able to, we share all of your data back live with you, not live, but as soon as we have uploaded it for you to a proprietary web portal where you can begin to see your disease trajectory, and you can look to see if any changes in your treatment protocol is having an effect on that trajectory, right? So if all of a sudden you're taking drug X and your, you know, trajectory, your graph starts to slope higher, you might want to reconsider that. Or if it slows your trajectory down, well, geez, that's a really great thing. So, you know, I'm plugging it, but trust me, we lose money on this, but we need the data. I'm not doing this to make money or to get any donations. You stay home. You stay right where you are. This is a virtual program. We will send you accelerometers that you can wear for about 5 days a month, as much as you possibly can, on each of your 4 limbs. And those devices will collect motion and movement data wirelessly. We even give you a FedEx envelope, all addressed and ready to go. You pop those babies back in, you send them back to us, we download the information, and suddenly we start to have a considerable amount of data on which to better understand this disease. There are already 700 of you who are involved in this program, and we need every single solitary one of you. And if anybody has questions, because I'm not gonna, I know we have a lot of questions on the topic. I don't want to take any more time on this, but it would be a great way to address those variables that you may have as you experiment with medical cannabis or whatever it is that you're doing in your treatment protocol. It would help you to discern the value of each one. The development directors are going to reach out to you. I think my email will be on a slide at the end. We can ask questions. Let's get everybody registered. That will help you along the way. Thank you for indulging me in that. And John, thank you for throwing that slide up. There's my email address, chamilton@als.net. All of us are our first initial, our last name at als.net. So if you think I'm super annoying, you can pick somebody else. I won't be offended. Erin, Emily, somebody, what do we got?
I've got a couple more questions. One is about, there's a small population of ALS patients that experience FTD or frontal temporal dementia. And somebody asked if there is any specific uses or if anybody has any experience with that type of ALS and the use of cannabis.
Eek.
It's okay if there isn't anybody.
That's a tough one.
It is. Well, I have another question that I don't think will be as tough. So our speakers, of course, were very young, Kate and Angelina, and I was so glad to hear from other speakers of different generations. But one of the questions that I got was, how do we get over the stigma of, you know, cannabis being a drug and it being known as, you know, an illegal substance for so long? I don't know if anybody's struggled with that, whether that's something that you feel pressured on from your network or your community, or just kind of a mental thing you want to get past. If anybody has any advice for somebody feeling that way. We did get a question about that.
I have an answer to that.
Okay.
Hey, John Russo.
I've been quiet long enough.
Yes.
I think once you medicate, you really won't care what other people.
Depending on the ratio, I suppose. You care less and less with the higher numbers.
I'm 65 years old, so I'm not a young guy making a joke. At the end of the day, with this disease, it really, you got to put that aside, whoever asked the question, because we have bigger fish to fry.
That's for sure.
Yeah.
And I think another way is the more people use it, you know, the less stigmatized it will be in the long run.
I definitely want to hop in on this question. I think
I bet.
This is why I really enjoy the job that I have and opportunities like this, because I think the education piece of it, especially coming from, you know, somebody with a white coat on, maybe that others outside of, like, when you're talking about your network, they may not hear it from you, but when they hear it from a doctor or someone, they might be more open to it. But that's why I love working with Curaleaf, especially as a company, because they're so big on the education aspect of things and getting the knowledge out there, right? So, and that's why I love doing what I do as well, being able to speak to patients, educating them, because there are a lot of patients who come into the dispensary and they're still scared and nervous about using these products. They may have gotten the card, but then they're still not ready to commit. And then after having that 15, 20-minute conversation with the pharmacist, they're a lot more comfortable about using their medications and a lot less anxious about what they were told growing up, all right, about what cannabis was or is, right? So that's the important piece of it. Education and advocating for it. And that's the importance of you all as patients as well. The more of you that advocate for cannabis or to use cannabis or integrate cannabis with your regimens, with your physicians, that'll also open up their minds or open up their perspective into integrating that with the medications that they're already using. So yeah, that's just my 2 cents.
Thank you. Dave Krellin, oh my God. Hysterical.
That's pretty much all the questions that I got. Some were really specific and I skipped over them.
Uh-oh, Erin's having trouble with her internet today. So she's freezing again. Luckily, it's not a half bad picture that she's frozen on. Not terrible. So I think what we're going to do here for a second is open it back up. Anybody have a non-chat question that they want to unmute for?
Carol, someone mentioned taking inosine. I don't know what that is. Is it INOCINE? I think it was Jerry.
Sorry, I'll unmute myself. It's a supplement, and there was a study being done with inosine, and my doctor, Dr. Walk at the University of Minnesota, recommended that instead of going into the study, I just start inosine instead of having a placebo. So, and you know, and Riluzole, both Riluzole, I'm not sure about inosine, but Riluzole, you know, they say that Riluzole, I think it's fairly ineffective. It only adds X amount of days to your life, maybe 5 days to your life total. So I take Riluzole twice a day, and I do it just because Dr. Walk says yes, but I don't think it's that effective. Inosine, I'm not sure what inosine does, but I do take it every day. And according to Dr. Walk, it's a good thing to take, and that's what I'm doing. So inosine is a supplement, and you can get it in a lot of different places without a prescription. So yeah.
What is the spelling of it?
INOSINE.
SINE. Okay. The only with some of these supplements, I know that my husband had been taking Tutka, which is a supplement, and in order for him to enter a clinical trial, he had to go off it. You know, they don't on any of those things. So I don't know if he'd be, and right now he's on a clinical trial, but it's something to look, to investigate for future.
Yes, so he may, and I mean, TUDCA is part of, the Amylyx trial. That in particular may be why they're doing that. But Diane, Harry can send you some more information on Lucine if you want.
Okay, that'd be great.
Yeah.
Any?
Oh, you went on mute. Diane, you're talking on mute there.
Okay. Any word on the EAP for Amylyx so far? Any webinars?
I do not have any
hasn't
news
been
on
anything.
that.
Okay, thank you.
Anyone else want to share or ask anything?
No, I was, hi.
Hi.
Hi. I was diagnosed 3 years ago. I am from Florida. I have been diagnosed, I am in the University of Miami in a trial with arimoclomol. So I'm taking the Riluzon and arimoclomol. And in the trial, they allow to take any of the over-the-counters, including Tuca. And maybe I can probably go with the Innocent that I'm not taking it. But if you go to any prescription medication, probably CBD was okay too. But if you take any prescription medication, they will not allow to go into the trials. And many trials are like that. They will allow what is approved, but not allow any other prescription.
Yeah.
Or at least what I was told.
Yeah, thank you very much. How you doing?
Progressing slowly. So I feel blessed. But of course, it's scary what is coming, trying to.
Your voice sounds wonderful and you have a beautiful accent. So, and I hope you continue to progress very slowly.
Hopefully. No, I think that something should come out. Amylyx is a little bit of something, but there are a lot of studies. So I try to keep thinking about that to keep myself positive.
That's right. Everybody stay healthy and give us the time to get you something really good and contribute your data to the precision medicine program. You'll help yourself and every single solitary person on this call and more. Anybody else?
Hi, this is
Hi.
Renee. Hi, my name's Renee, and I was diagnosed 2 years ago with ALS, and recently, within this past year, I've been having a lot of difficulty sleeping and waking up every hour, hour and a half, and being very uncomfortable in a certain position and requiring help to reposition myself because I'm not able to move as well. So I started taking THC and CBD, and I started off with 3.5 milligrams of THC and 1 milligram of CBD. That wasn't helping with my sleeping, and I was still uncomfortable. So I changed to 10 milligrams of THC and 6 of CBD, but cut in half. So I had half the dose. That was working, but it wasn't consistent. So then I was told that I should probably try CBN and THC. And I'm currently taking 5 milligrams of THC and 3 milligrams of CBN. And that seems to have helped me a lot. I can only wake up 3 times a night, and I only have to be repositioned three times, and I'm much more comfortable, and my sleep is a much more, I have a deeper sleep, so that seems to have helped me. So my question is, what is the difference between CBD and CBN?
Oh, good, because when you were saying that, I was going to ask that question if that wasn't yours. So Dr. Charles, can you talk about that?
So CBD and CBN they're just two different cannabinoids in the cannabis plant. CBN is actually THC is actually a precursor, or said to be a precursor for CBN, so it can metabolize into that cannabinoid. Some patients state that CBN can help them with sleep a bit more than CBD or other cannabinoids. But again, until we can really pinpoint and do trials on each cannabinoid and what they specifically can do, I won't be able to tell you exactly how they work or what it's best for or good for, but there is a lot of popularity now with CBN in terms of how it may affect sleep.
Yeah, I use CBN at night with THC, and it's a really important muscle relaxer.
You know, I did notice when I first started taking the THC and the CBD and CBN, but more so the THC and CBD, I noticed that I'm still able to get up and use the commode at night. But I did notice that when I was getting up, of course, I have somebody, my caregiver, helping me get up. I did notice that my muscle movement was much slower, and I felt like that I could fall very easily. So, but with the CBN, I'm not noticing that as much.
So interesting. Thank you so much for sharing that. This is so valuable. And now I have a question. I know, and I saw Erin struggle with this a little while ago. What do we call when something has a name? Is it a strain? Is it a type? What is it when you say, I use Green Monster?
Okay, so this is a good question. So there are specific strains, or people categorize specific strains of cannabis. And the best way to explain that is you have specific strains because every cannabis plant that grows is going to have its own unique terpene profile, and then also look and feel, or that it ends up looking like when it grows, right? So those aspects are how people get strains. Terpenes are the unique plant chemicals that also are found in fruits and vegetables and spices that give fruits, vegetables, spices, and cannabis its smell and its taste. So the different combinations of terpenes will help to make like a unique plant in a sense, and that's where these strains come from. There are people who believe like the different terpenes of the plant cause that plant to have a different physiological effect for the person consuming it. And that's why people will say or state like this strain does this for them or helps them in a certain way. But we don't really have a true understanding of how that works within the body. But that just answers what strains are or can be.
I just like to say here, this is Jay, that it's just branding. Basically, Cureleaf, for example, has a number of different brands. True Leaf has a number of different brands. The way you really should rate it is it an indica? Is it a hybrid? Or is it sativa? And you have different reactions to different ones. When you go into a dispensary, they have a sheet which lists all the different names, Jackie Girl and Green Gorilla and all those crazy things. But it tells you if it's an indica, hybrid, or sativa, and what the percentage of THC is in that particular plant. And that if you're buying that Green Gorilla or whatever it is, but it tells you the actual percentage of THC.
In the dispensary?
Yes, in a dispensary, there's a list. If you go to a dispensary, you could ask for the list of what kinds of flower they have, and they'll give you a list of what they have and what the percentage of THC is. So it not important what the name is, it's what the ratio of THC is and what type of cannabis it is.
Finally, in my 50s, I'm learning to talk pot. This is great. Right? Bill, do you have a question or are you high-fiving me? Reverend Bill Haskell, everybody, one of our faves, formerly of Blue Bonnet Conference. You're still on mute though, Bill.
Oh, Bill posted in the chat. He said,
Oh.
wait, I see people leaving. If you're not in the PMP, just do it.
Oh, yay, Bill.
Thank you, Bill.
All right.
If
I just wanted to say,
yeah,
I put on the chat part, leafly.com, leafly.com, gives the information of different streams, what they do, you know, their hippie names and all that stuff.
Awesome.
Thanks, Dave.
Thanks, Dave. I just wanted to say, I know Angelina has left, but she wanted to say if anybody would like to email her, ask any of us from TDI. Her email is just angelinafanous@gmail.com.
Great. Terry, will you just put that in the chat for people?
Yep, I'm just
Copy
doing
and
it
paste it?
right now for you guys. Yep, Angelina.
They can have my email as well, Terry.
Yay.
Oh, thank you, Kate.
Or phone number if you prefer a call.
Thanks, Kate, so much. And then thank you, Dr. Charles. We appreciate all of your time and help.
This has
Thank
been
you.
terrific.
Patience.
Thank you so much. Now, remember, we're going to send you a survey. You're going to hear from a development director, most likely Terry or Carol or Erin or Claire. We want your honest feedback. So if you didn't think this was as helpful or as informative as I think it was, that's great and fine. And we want to know that because we're not doing this for us, we're doing it for you. So we want to make sure that we're providing you the kind of information that you want, and we want to hear your ideas on topics going forward. So Jeepers Creepers, thanks so much, everybody. John, anything, what am I forgetting?
I think we're good. Just thank you to Clay and Kate and Angelina.
Seriously.
And everyone who asked questions.
Yeah, and shared their stories too. Really helpful to hear from, you know, everybody.
I have a quick question.
Sure.
I see that it was being recorded. This Zoom was being recorded.
Yep.
Will the Zoom be distributed, or in a way, will it be distributed?
It's funny. We were just texting about this on the side. We will get you the link, Jerry. It'll take us a few days, everybody, to
No worries.
get this archived and up and do any editing that we may have to do. I don't know that there will be any in this case, but
No.
it will be available, and we'll make
Great.
sure
Great.
Erin will let you know when it's up.
Great. I just wanted to say while I'm here, ALS TDI is the best. It's the best. And so anybody who can raise money for them, or anybody who can donate, they really are good. And it's true. They're the only ALS institute that's research that's all about ALS. It's just, I don't know, I'm so impressed with the whole team. Fernando, Aaron, Jonathan, and Alan. So
Yeah.
I've been in touch with all of them very much. Aaron a lot, Alan a lot. I do the PMS thing, the trackers.
Yep, the PMP,
Yeah,
yeah.
so it's great. I'm just so impressed with ALS TDI, and anything we can all do for ALS TDI, let's do it.
Thank you.
Jerry. That means a lot.
Thank you so much.
Ellen, thank you for your
you.
enthusiastic nodding on that. We all appreciate that. Really.
Absolutely.
We'll
Thank you.
take the help, you know, we'll take it. There's good reason to be doing this work.
Sure is.
Okay, everybody. Dr. Charles, Kate, Angelina, you're not here, but you're here in spirit. Thank you, thank you,
Thanks,
thank you.
everybody.
This was fabulous. I really enjoyed it.
Thank you.
All right.
And thank you.
Thank you, everyone. Thank you for having me, everyone.
Thank you.
Bye, everybody.
Thanks to all.
Thank you, everybody. Thank you so much.
Hi, Diane. I'll have information for you about ions.
Got it.
And-
Thank you
and
so
Diane,
much.
Thanks for sharing stuff.
Oh,
Thanks
no
for your
problem
help.
at all. All right, will do. Take care. Bye-bye.
Bye, everybody.
Bye, Jay. Thank you for your help today.
You're welcome.
Okay, take care of that puppy dog.
You mean this big old guy?
Oh my gosh, there's Otis.
Yeah, that guy. That guy.
100 pounds of doggy.
Loving therapy dog. I gotta go feed him now. See you guys later.
Bye, guys.
Thanks, Dr. Charles. Bye, everybody.
And Jay, who pretends his name is Ronnie, thank you for sharing.
Yeah, it was quite confusing. Jay,
He's
but-
his wife's iPad.
Bye, everybody.
Thank you.
Bye-bye.
Bye-bye.